All right, we're back to another lesson. So we are looking at 4 levels in EMS in regards to providers. Okay, class in session. There we go. All right, so now we're going to look at the 4 different levels within the scope of practices. We talked about the scope of practice before, which is within the area where you're trained to do what you're supposed to do in the sense of your training. And depending on what level you are, that's the level you stay in. As the further up in your levels of training, your scope of practice expands more and more and more. Now, one thing I can say, as I was a young man, I did some martial arts, and in martial arts, there's, in the traditional principles and disciplines, you have different belts. So you have a white belt. Now, after white belt, there are different colors for different types of arts, but I'm just going to give you a basic one. So white belt is usually the beginners, yellow belt's the next level, green belt, well, I'll say white, yellow, brown, and black, because there's 4, okay? So let's look at the first level. This is going to be the white belt. So the white belt is also known as, right over here, EMR, Emergency Medical Responder, okay? And some people call them CFR, Certified First Responder. So these are the white belts. Usually within the course, there's a certain amount of hours they have to make. So in this arena of the EMR, it's usually between 150 to 200 hours in classroom time. Okay, they specialize in managing the patient emergency skills, basic life support, all right? And usually the EMR is usually first on the scene before the other EMTs arrive, okay? And some examples of some EMRs can be police officers, firefighters, park rangers, and usually they'll be there before you're there. They're just stabilizing the patient. All right, the next level, I'll call it the yellow belt, will be the EMTs, Emergency Medical Technician. So the Emergency Medical Technician have more training, basic care, basic life support. Also, they can transport in their ambulance, or however you call it, depending on what region you're from. Some say ambulance, rig, or truck. Their extensive work will be 150 to about 200 hours of classroom time. So you're noticing the hours are increasing. All right, and that's where we are in our course. We are EMTs, Emergency Medical Technicians. So we get the training, we get all of the different basic support. I mean, EMR does have it, but we get just a little more, maybe some additional things that we do that EMR doesn't do, and the scope of practice becomes more, right? Expands a little more. So basically that's the link. So we are there on the scene, we take the patient and we transport them to the appropriate facility. The next level is known as AEMT, They're advanced EMT. In some regions they have them, others not so much, but they have an additional hours. So their hours is from 200 hours, within ranging 200 to 400 hours, based on depending on where you are in the nation. They do IV access, intravenous access. They do advanced airways and some of the different medications there. So as you notice, the arrow is pointing up. So the higher you go, the higher the level of training. The last but not least is going to be the paramedics. All right, so the paramedics are the ones that does the most. Now, they're also known as ALS. All right, even here for EMTs, they're BLS. All right, so paramedics, they get, you ready for this? 1,000 or even to 2,000 hours of classroom. Usually the average paramedic class would be like 9 months. All right, so there is they're the highest medical authority. All right, so when you get on the scene, paramedics on the scene. They're the highest medical authority at that scene. So they do EKG, all right, interpretation. They can do other advanced airways, more medications, and they definitely work under the medical director. So this is the team. This is the team of individuals on that scene that can help patients, whether it's a medical patient, trauma patient, and we stabilize them and they can be transported to the hospital to get more of definitive care and all the needs based on the call type. So this is just the 4 levels of in EMS. All right. So I hope you enjoyed this. Please subscribe, as well as like and share. Okay, just trying to keep it as simple as possible. As they say, KISS, right? KISS. Keep it super simple. So I hope you enjoy until the next video. And again, have a good one.